Good day, everyone. I'm pharmacist Faiza Himasa Idris. I'll be presenting on the topic pharmacy databases and other useful tools. I'll be talking on PubMed today, ResearchGate, Mendeley, MDEX, Medscape, and Drugs.com. Let's start with PubMed. PubMed was developed and is maintained by the National Center for Biotechnology Information at the United States National Library of Medicine, located at National Institutes of Health. It has been available to the public since 1996. PubMed is a free research engine accessing primarily the Medline database of references and abstracts on life sciences and biomedical topics. It comprises more than 34 million citations, and these citations may include links to the full text content from PubMed Central. The aim of PubMed is to improve health both globally and personally. Features of PubMed. There are three main features: Medline, PubMed Central, and Bookshelf. Medline is the largest component of PubMed, and it consists primarily of citations from journals selected for Medline. That is, articles indexed with MESH and curate for funding, genetic, chemical, and other metadata. I'll explain more on MESH in the coming slides. PubMed Central. Citations for PubMed Central make up the second largest component of PubMed. It is a full-text archive that includes articles from journals reviewed and selected by National Library of Medicine for archiving. The third component is Bookshelf. The final component of PubMed is citations for books and some individual chapters available in Bookshelf. Bookshelf is a full-text archive of books, reports, databases, and other documents related to biomedical health and life sciences. PubMed User Guide. As a new user, how are you going to search on PubMed? It is important to know about two things: the search operators and the mesh descriptors. The search operators are also known as Boolean operators. They are and, or, and not. This helps to define the relationship between keywords or group of keywords during the search processes. For example, let's take and. Will help find all keywords containing all the search keywords. For example, cancer and therapy. When you want to search on articles containing cancer and therapy, you can use the word and to link the two words together, cancer and therapy. For all, it retrieves records containing any of the searched keywords. For example, you want to search on articles containing nanomycels or articles containing nanoparticles. So you can use the or Boolean operator to search this. You just use nanomycels or nanoparticles as your research keyword. For not, it eliminates records that contains a certain keyword. For example, you want to search on articles containing medicine and not diet. So you can use the not keyword to eliminate articles containing medicine, articles containing medicine and diet, and just focus on articles containing medicine. This is an example of the PubMed user interface. Here you'll see the Boolean cubes, the Boolean operators, and, or, and not. Like the example I gave earlier of cancer and therapy, I used the Boolean operator and to link cancer and therapy and to get articles containing only these two major keywords. The mesh descriptors, which is the second search method, it is medical subject heading, and it is the standard terminology that helps defining topics and retrieving related articles. For example, if a researcher is interested in articles related to severe acute respiratory syndrome, SARS, the mesh browser will retrieve all articles containing the text word SARS. And also in literature, the concept of cancer can be described in various ways, like cancer, cancers, tumor, and neoplasm. So if you want to search on articles containing cancer microenvironments, you can use tumor microenvironment as your keywords and you get the same thing. This is an example of the mesh terms. I use cancer therapy and nanotechnology to retrieve articles containing this keyword. It is a more advanced search builder for PubMed. Methodology for an efficient search. Firstly, you formulate your search questions. You define which databases will be better for your search. You verify whether the database makes use of keywords or controlled vocabulary. Identify the topics of your interest or possible keywords and use the mesh search terminology. The second thing we are going to be talking about today, the second database, is ResearchGate. It is an academic profile and social networking site. It was founded in Berlin in the year 2008 by two physicians and a computer scientist. It is a professional network for scientists and researchers. ResearchGate helps researchers connect and make it easy for them to share, access scientific outputs, knowledge, and expertise. How is ResearchGate useful? It connects researchers with colleagues, co-authors, and specialists in the same field. It helps you access publications and other work in the field. It helps in asking research-related questions and get answers from experts in the field. It makes your profile visible and discoverable to other researchers. It helps you share your preprints and other early work to get feedback from other researchers before you publish it. There are two main features of ResearchGate. The primary feature is individual researcher profile. Each researcher has its own research profile where it shows the name, the discipline of the researcher, what he's working on, the statistics, and all that. Then the distinctive feature of ResearchGate is that it has a question submission and response knowledge base, whereby any researcher or even a student can drop their questions and get answers from other people in the field. This is an example of the user's profile, the researcher's profile. The name is there, the profile, research, start, and the people they are following. You can also get an insight of your citations, your H index, and research interest score. The third database we are talking about today is the Mendeley Reference Manager. It was developed and is owned by Elsevier. It is a free web and desktop reference management application. It simplifies research. It simplifies research and reference management workflow so as to focus on achieving the main goal. Features of Mendeley Research Reference Manager is that it collects references, it generates citations and bibliographies, it reads, annotates, and highlights PDFs, it helps you collaborate with other researchers online, and you can import papers online to your Mendeley research profile. You can find relevant papers and articles. You can access papers anywhere online. You can read papers on the go without saving it. And you can build a professional presence with the help of Mendeley Reference Manager. This is an example of the user interface. There you have your library, whereby you have your documents, the documents you recently opened, the ones you added recently, your publications. You can also customize it as needed. Here, when you want to search for a paper, you can either search by author name, the mesh, that is the medical subject heading, or the year. So for example, let's take this article as an example, mode of transient drug diffusion, so across the cornea. So here we got this from the article itself and we want to cite it. You just go to your Mendeley plugin, you click on insert citation, type the mesh search keyword, and it will come with the reference name and all. So you cite it. And also you can use Mendeley to create your own bibliography. For example, we use this APA style, Vancouver style, sorry, of referencing. So you can change it to the APA style, the American Psychology Association. You can change it to other different styles as needed. The fourth database we are talking about today is MDEX. It is an essential medicine index and is most commonly used reference source of drug information by healthcare professionals in Nigeria. It is also the largest and up-to-date source of information on drug products approved for use in Nigeria by the National Agency for Food, Drug Administration and Control. MDEX has features like search by brand names. You can get the strength of the drug, the dosage form, the NAFDAC number, product description, pack size, storage recommendations, and manufacturer supplier. By the right here is what the user interface looks like. There is a place you can search drugs by their generic name or brand name. You can search indications, that is disease conditions, and get drugs used to treat that particular disease condition. There is a classification of drug by the drug classes. You can add 2 drugs and check if they interact, 2 or more drugs in the drugs interaction page. You can access MDEX online from the app too. And there's a place you can save drugs you are interested in reading more about. This is what the user profile looks like. And this is an example of the classification of drugs according to alphabetical order. And there is a news feed where you can get updates and information from Food Drug Administration and all. The 5th database we'll be talking about is Medscape. Medscape is primarily a drug, disease, and treatment reference with point-of-care decision-making tools. The features of Medscape include drug and drug interaction lookup, pill identifier, medical calculators, procedure references, and more. This is a more detailed look on the interface. We have the drugs where you can get drugs, the list of drugs by either disease condition or alphabetical order. Interaction checker, whereby you can check if 2 or more drugs interact. Conditions, that is the disease conditions. Podcasts where they talk about health and all. Procedures, decision points, calculators, pill identifier, whereby the tablet is there or capsule is there, but there is no pack or anything to identify the drug. So pill identifier will help you with the little you know about the tablet to know which drug it is. Cases and quizzes to keep users engaged. Formulary, direct, and directory. This is what the user interface looks like. You also have a news feed here, whereby there are updates from like Food Drug Administration and many other centers. The last database we'll be talking about is drugs.com. It is the most popular, comprehensive, and up-to-date source of drug information. Drug information app with A to Z drug list, dosage, drugs by class, generic drugs, side effects, medical questions and answers, Harvard Health Guide. Here also there are tools like interaction checker, pill identifier, and symptom checker. Drugs.com also contains a news and alert section to receive updates from Food Drug Administration, popular articles, and the likes. This is what the user interface looks like. There is my med list, whereby you saved names of drugs you are interested in reading more about. There is the drugs name from A to Z. You can find drugs by drug condition, by disease condition. There are FDA alerts. There is a pill identifier. Side effects of drugs can also be checked here. Interactions checker, pregnancy and breastfeeding section, where you can see the drugs for pregnancy and breastfeeding, and drugs you shouldn't take. There is a price guide depending on your location. There is phonetic search, whereby the name of the drugs is not written or cannot be identified from the prescription paper, but the pronunciation is there. So phonetic search will help in searching this. There is a support group. There is a symptom checker. There is a place you can connect with other health professionals, and there are dosage of drugs, all in drugs.com. So I got my information from PubMed itself, ResearchGate, Mendeley, Elsevier, Medscape, MDEX, and drugs.com. Thank you.